Now we come to the pathology, that is the VSD murmur. So VSD, we know there is a hole in the ventricle septum. In very easy way to tell that there is a hole in the ventricle septum, due to which whenever the ventricle contracts, so whenever the ventricle will actually contract, it will lead to the blood going to the other ventricle. So it is a systolic murmur because the ventricle will contract to in order to exchange of blood happening through this hole, right? First, this is a systolic murmur. Second, it is a hollow systolic murmur. A hollow systolic because even from the starting till the end of the contraction, there will be the blood going through this hole. Okay, so see, this is a hollow systolic murmur. See, hollow systolic, harsh sounding murmur, loudest at the tricuspid area. Now you need to know this. It is loudest at the tricuspid area. This is a different point. Okay. Now this is congenital. Okay. Next, let's go further. Now we have two diastolic murmurs. Basically, it is the aortic regurgitation and the pulmonary regurgitations, or we can have the mitral stenosis and the tricuspid stenosis. But for us, these two are important, right? These are diastolic murmurs, so obviously it will come after the S2. See, it is coming after the S2. Okay, so we have the diastolic murmur in case of the aortic regurgitation is the early diastolic murmur. Okay, because as soon as the contraction of the ventricle ends, the pressure in the aorta is so high that as soon as the contraction ends, the regurgitation starts. So it is early diastolic. Okay, it is decrescendo. Decrescendo because uh, it is loudest whenever it starts, that is, when the contraction of the ventricle ends, the gush of blood will regurgitate, but afterwards, as the pressure equalizes, the gush of blood reduces. So it is a decrescendo. High pitched, I told you every thing we are reading right now is high pitched. You need not to learn about it is whether it is high pitched or low pitched. Very few things, that is only three things in cardiology are actually low pitched. So high pitched blowing murmur is there, that is obviously best heard at the base. Base means aortic area. Okay, at the base, that is a second intercostal space on the right hand side at the sternal border. Okay, at the base, that is the aortic root dilatation, or left sternal border, sometimes on the left sternal border. So basically the thing you need to know is regurgitations actually occur due to different pathologies. Sometimes the valves leaflets are not good, or sometimes the annulus is not good. Depending upon that, we have different regions, but you need to know for your theory and your practical purposes, you need to hear the second intercostal space, that is the aortic area only. Okay, then we have the mitral stenosis. Mitral stenosis, you need to know a thing, that is the opening snap. I have told you in my previous video what a opening snap is. If you don't know, please go back and see the video. So following the opening snap, we will have a delayed rumbling mid to late diastolic murmur. So why the mitral stenosis is taking place, let's see. We have done it. Then mitral stenosis, in case of mitral stenosis, we know the blood is not coming properly into the ventricle, right? And it is occurring in the diastole part of the cardiac cycle, right? It is occurring in the diastole. So you need to mug up this thing, that it is a delayed rumbling. Obviously, it will always occur after the opening snap. Okay, I'll tell you that opening snap is when the leaflets of the mitral valve opens up. It is opening snap. After the opening of the mitral valves, obviously, then the blood will come. So after the opening snap, the blood will come, leading to the murmur. Okay, so delayed rumbling, mid to late murmur. S1 and OS correlates with the increase. Okay, this is a very, very important question. This you need to know. It is asked so frequently that what is the severity of the MS? MS severity is basically the length of between the S1 and OS. Okay, the length, the duration of the S1 and OS actually tells you the severity of the mitral stenosis. It is a very, very important point. Please do remember it. Now we have something that is a continuous murmur. Continuous murmur is when the murmur is actually present in case of the systole and the diastole both. Now, one thing we have done, it is the holosystolic. See, holosystolic is that is present only in the systole. Okay. Now, continuous murmur is different. Continuous murmur is different than the holosystolic. Now, continuous means it is present in the systole, also in the diastole. So, we have the patent ductus arteriosus. See, whenever we have the patent ductus arteriosus, at every moment of time, whether it is systole or whether it is diastole, okay, so every time the aortic pressure will be more than the pulmonary artery pressure. Every time the aortic pressure will be more. So the blood will always go from the aorta to the pulmonary artery, no matter it is contraction of the ventricle or the relaxation of the ventricle, no matters. What is the phase of the cardiac cycle does not matter. Okay. So it is a continuous murmur. Okay. Best heard in the left infraclavicular area. This thing you need to know. Best heard at the left infraclavicular area because the patent ductus arteriosus, the surface anatomy marking is near the left infraclavicular area. Now the loudest is at S2. If you need to know, if you need to remember, you can, but at least continuous murmur thing you should know. Okay, that's it.